when we originally formed the organization about 6 years ago, that was really our goal. We wanted everyone to have something to do on Monday when they go back to work. And that's really been throughout the first 4 meetings. That was really our goal, to give people a lot of practical information, so they can go back to their offices Monday, put into practice what they learned, and make it effective for them. And that's going to be our ongoing goal with education moving forward, is to have that same mindset.
Yeah, well, you've done a fantastic job. So kudos to you for setting all this up. It's been great. People might not know of you, or they've heard of you, but you were one of the pioneers sort of this field of sports vision. And I wonder if maybe you could take a second and just sort of tell everyone about your practice, your sports vision practice, and how you got started doing this.
Yeah, I mean, really how I got started when I was in optometry school back in the Ice Age. I graduated about, 32 years ago, 32 and a half years ago now. My 4th year project in optometry school was I really wanted to do something in sports vision. So I was at Southern College of Optometry. I got with Dr. Glenn Steele, and we actually worked. I did a study with the Rhodes College baseball team, and that was really my first foray into sports vision. And when I got out of school, I really wanted to, do more sports vision. That's really what I loved. And, but it was hard, it was hard being a young practitioner. Back then there was not a ton of research out there, on sports performance and vision. But the nice thing is I was able to work with a Little League baseball team, and everyone's skills improved. But what I also learned is, I kind of learned during that time that, all their school skills improved also, which was kind of cool. So, I kept doing what I was doing. I joined an organization that was around then called the International Academy of Sports Vision, and actually ultimately became vice president of that organization. Back in the around 2000, the executive director retired, and pretty much the organization went away. And then there was a void in our field from an organizational standpoint in sports vision. And then, I think what happened was, and then rumblings were that AOA was going to make the sports vision section now the sports vision committee. And I really felt that void, because I really wanted to expand more back into the sports vision field. And I was getting more and more opportunities to do that on a personal level, working with some of the teams here in the Dallas-Fort Worth area. And so basically, one day we're sitting around at a COVD meeting, myself and Alex Andrich and Benoit Lambert from Belgium, and we said we really need to have an organization that really focuses on sports, where we get all the vendors in under one roof, or in this case, one exhibit hall, virtual exhibit hall. But we wanted to do that, so we actually had our first little organizational meeting, which was more of a think tank we did here in Dallas back in end of 2014. And then we did our first meeting the next year, the early 2016. We did our first meeting, and then we've done it in February ever since. And I said this is our 5th meeting, and in a very unique way to do a meeting. But certainly we hope to be back live next year. I think it's been a great experience. The meetings have grown, has doubled in size virtually every single year. So that's been the really exciting thing to see in it. So I kind of got started, and just kind of figured things out along the way. But, it's been an educational experience, and I've certainly learned a lot from going to these meetings.
Absolutely. And I'm actually pulling up on the screen here right now so people can see. I have your practice actually up there, your sports vision practice. And I think a lot of people want to hear, as someone who's been in the trenches, who runs a very successful sports vision practice, what do you do in your practice, like technology-wise? We've been going on and on this morning about the different, various products, but I'm curious, what do you use, in your practice? What do you actually, on a day-to-day basis, work with?
Well, it's not really fair, because I'm really a techno nerd. So I love the technology. I mean, I pretty much have almost everything you're going to see in the exhibit hall I have. So, I mean, I have Synaptic Sensory Station. I have Binovi Touch, and really the whole Binovi system we use in our office. We do balance tracking systems to do balance testing. You're going to hear me talk a little bit about that this afternoon in the concussion lecture. We do Right Eye. We do Cognivue. We do, we've done other neurocognitive tests in the past, like impact and things of that nature. We do fit lights. As I said, we have so many of these tools that I've gathered over the years. So technology is definitely, if I were to think about, as I've gone through this for the last 30 years, the biggest change, there's really been two major changes that really have promoted sports vision as a whole. One is the technology has really caught up with the thought process. And so we have all these technological tools that are at our disposal, but we also have some of our traditional non-technological tools that are still very effective. And then the second thing that's happened is obviously things like Twitter. We can get the word out that we're doing these things. And, social media has allowed us to really explain to people the concept of doing vision training for athletes. And really showing some of the activities that we do. So I think those have been some of the two biggest changes we've seen in the last 30 years that have really expanded the role of sports vision in this world.
Yep, absolutely.
Well, speaking of 30 years, being in it for 30 years, has the type of sports that you were correcting expanded? Did you start with, for example, just baseball and then move into basketball, etc.?
Yeah, I think obviously because I had the most familiarity since school with baseball, I started out with baseball. But now really a lot of what I do. I mean, I've seen shooting sports, I've seen lacrosse, I've seen all these other sports that have cropped up, and obviously since here in the Dallas area we've had ice hockey since 1993. It's grown a huge amount here in the South, and I'm a big hockey fan. So I kind of found myself into the sport. I worked with one of the minor league teams. This is my 8th season working with them. This is my 2nd season working with the Dallas Stars. Unfortunately, because of COVID, we've been very limited of what we can do this year. We're pretty much locked out of the bubble. This is not my 4th or 5th season working with FC Dallas and soccer. I also at sometimes work with the Dallas Sidekicks, which was the indoor soccer team for a while. I work with the Texas Legends, which was the basketball team, which is the G League basketball team for the Dallas Mavericks. So I've gotten some great things. But then again, I've also worked with a lot of high school athletes, high school hockey players, high school basketball, lacrosse players. So, yeah, obviously the range of sports that I've worked with has definitely increased. But you know what? I don't really... while it's important to actually have some knowledge about each individual sport, I think what happens is if you have a good working knowledge of the visual system and the visual process, you can really work with any sport, even if you're not a big sports fan like I am. But you can really work and learn and kind of figure out what's involved in the visual process if you think about what each person does at their position, at their level. So I think that's the important thing to understand, because I've done sports vision training on sports I've never played or never participated in. I just had to learn a little bit about what each particular person did. So I think really we can do any sport.
Yep, and
Right.
even some things that haven't been considered sports, right? So, for instance, I've got an 11-year-old here at home, and I can tell you that esports are becoming probably even greater. I was lamenting because spring training started for baseball, and I was all excited, and my son was like, "Yeah, whatever," because he's much more into
Right.
the esports, and he knows all these other players who play these games, and I wonder, I think that's an opportunity that a lot of people are missing, that these sports are evolving past the traditional ones that we all think of.
Certainly, esports are becoming huge. And in fact, I'm hoping in the next year, and I've had some preliminary discussions about this, that we will be doing really some really promote vision training for esports athletes throughout the world. I've talked to some researchers. I have some people connected to the esports channel, the YouTube channel, and they may want to do some stuff on vision therapy in the future, and I hope they do. So esports is one thing. The other area is the area of performance vision, and we should forget that. Last year, I had the opportunity to work on with a Dallas SWAT officer who had suffered multiple concussions, and we did a lot of sports work with him, just because we had to get him back to that, because these SWAT officers are really high level athletes, if you want to think of it that way. So that the whole area of performance vision, working with the military, those are other avenues of sports vision, and really maybe we should just change the concept of sports vision to sports and performance vision. I think that really makes a lot of sense.
Yep. And you actually just brought up a topic of concussion, and I know it's a big one here at this talk. You guys have been giving, and we talked to Deanne Fitzgerald yesterday about this epic 3-hour-long talk on concussion. So maybe we could shift gears here and talk a little bit about that too. Deanne was really pushing on the fact that these days you can get a lot of objective data around concussion, which perhaps in the old days was a little harder to get. Maybe you could speak to that a little bit about folks who are now, having to evaluate concussion and how that works in your practice.
Absolutely. I mean, I've been involved working with traumatic brain injury patients for the last 18 years in practice. And we learned a lot over that time period, and we started seeing more and more concussion patients. We saw a lot of TBI patients, and realized that we can definitely help them. But I was always a big advocate of objective testing, and the reason is, and here's a really important point: if it ever went to a legal situation where you had to go to court, and I did my most recent deposition last week. Okay, so it happens. If you have to go into a legal situation, having objective testing is incredibly powerful. Okay, so that's one aspect of it. If I can go into and doing a deposition, I can show what their balance was like before and after. If I can show them what if I could do a right eye and they can see how their tracking was compared to a normal, things of that nature. That is very, very powerful information in that particular arena. On the other side of things, obviously, it helps me prepare a treatment plan for that individual patient that is far more succinct. So not only can it takes a lot of the guesswork out of it, if you want to think of it that way. And when I can take the guesswork out of it, I can get people through a therapy program much more rapidly, much more efficiently, the more information that I have to work with. So that has been a big game changer in the whole thing. And that's, once again, another nice use of technology. But you can have things like VEP, visual evoked potentials. You can have right eye, balance testing. There's a new thing that Deanne and I are going to talk about later in our lecture called WAVI that we're using. It's kind of a EEG measurement device, and it measures what they call ERPs, which are potentials. When you evoke potentials that you're looking at, when we actually give them a visual task, we give them an auditory task, and we give them a visual cognitive task, and we were recording their brainwaves while we're doing this. And it really comes out of the concussion world. It doesn't come out of the vision world, but it gives us a lot of useful information. And then we can do a before and after to show the effectiveness of training. Once again, vision therapy and vision training needs more research, and by doing objective measurement, it's hard to refute the successes that we have in improving these people's lives.
Yep. And Deanne mentioned one new tech that she had implemented and is using now, Cognivue, and I can put it up on the screen for people. When we talk about objective measures, I think this is a really good example, right, of a device that can actually give you very clear, concise data that you can even show patients, to track their progress or even clear them, I suppose, to get back on the field.
Absolutely. In fact, I just did my lecture for Cognivue just prior to coming on the phone call with you today. Cognivue is something that I've had in my office since the last sports vision meeting. I think that's really when I got started with it, and maybe even before that. But it has been a really cool device. First of all, I think what we have to understand is vision is very much tied to cognitive. Okay, visual information is really, really important. Obviously, even going back to some of the older cognitive tests, that visual aspect is really a key factor in the whole thing. The other thing that Cognivue does beautifully is there's a motor component too. So you're seeing something visually, and then you're making a motor movement to compensate for it. So I think that combination of vision and motor that you get with Cognivue has been a really, really effective tool. The other major advantage of Cognivue over other neurocognitive tests are the fact that it takes 5 minutes. Okay. And if you have the long version, it takes 10 minutes. But most neurocognitive tests take 20 minutes, the computerized ones. And then some neurocognitive, if you go to a neuropsychologist, for instance, you may be there a half a day. The problem is that I see is if you have a person who's had a concussion, their ability to do something past 5 minutes is probably going to be pretty limited, especially early on. Okay. So their cognitive skill is going to decrease as they get more and more visually fatigued, and they get overall fatigue and brain fog and all that other stuff. So to do a test in 5 minutes is really going to give you really an accurate assessment of where they're at. It's going to tell you what's going on in the frontal lobe. It's going to tell you what's going on the visual spatial system. It's going to tell you kind of what's going on in the, just in the overall cognitive abilities and reaction time. So I think it's a really, really effective test for an optometry practice or an ophthalmology practice. A great tool for us, because we need some information, but we don't need every little bit of information like perhaps a neuropsychologist would need. So it gives us great information.
Right. And, I saw this device a couple of years ago, I think at one of the expos right before the world fell apart. And, I'm putting it up on the screen right now. It looks different from the original one. It looks like they have two different models now, and they look smaller than I remember them. I mean, I know it's been a long time since I've traveled and been to a vision show, but this looks different. They have the Clarity and the Thrive now. So that's new, right?
Right. Yeah. So I started out with a Clarity unit myself, and that's, and they had two options on that one, a 5-minute test and a 10-minute test. And I started with the 5-minute test, and then I moved to the 10-minute test because it gave me a little bit more information. And the Clarity unit I still use. I mean, I still use it some, but it's not very portable. So when I do, like, for instance, when I go to do a screening with FC Dallas in a few weeks before the soccer season starts, I'm going to bring the Thrive with me, which is the newer unit, because it's basically a laptop. Okay. And it's very portable, and it's easy for us to bring it into a facility and do testing locally wherever we do. If you're doing a vision screening, you actually do the Cognivue Thrive. And once again, for an optometry practice, ophthalmology practice, it's going to give you more than enough information. So I would say that 80% of the time in my practice now we're using the Thrive. But we still do use the other unit if I need something a little bit more in depth. But they're both outstanding, and they're both very, very give us a lot of useful information.
Yep, and I'm putting up on the screen right now so people can see the report that it generates, right? So this is a fairly easy to understand even for patients, right? So they can sort of track their progress.
Absolutely. In fact, I usually give a copy of the report to the patient. I think it's really nice for them to have. But yeah, they kind of see where they are. And then, once again, when you complete therapy, you can repeat it, and you can see what areas have improved and what areas that might still need improvement. So, especially, obviously outside the area of sports, the other important areas for a neurocognitive test might be something of patients who have Parkinson's or Alzheimer's or some other neurological condition. I'm actually doing a study right now for visual snow, which is a whole nother ball game. But I'm in the process, and we've actually tested many of our visual snow patients with this just to see where they are from a cognitive standpoint. Just because I was curious to see if there was a cognitive deficit that was brought about by having a neurological disorder such as visual snow syndrome. So we're definitely trying to find different areas to utilize this outside of our sports vision practice. We use it on all our TBI patients, all our stroke patients. So there are numerous areas we use it. I even use it in some of my older pediatric patients just to see where they're at, because I think it can be very, very telling.
Right, and on the report, go ahead.
So for one question, for people that are new in this area and they want to start, how much space does it take in an optometric office? to do these things?
Good question. It does take some space, but I think, there's enough variations on the equipment that a lot of stuff out there can be tablet-based or PC-based, that are done on simple computer screens. So you can have one computer that does 3 or 4 different activities for an individual. So a lot of times you can do it. Right Eye kind of is self-contained in one unit. Cognivue is kind of self-contained in a separate unit. But a lot of other tests can be either done on an iPad or a laptop, and you can get the information you need out of it. Even Wabi, we do, it's just based on a small laptop. So it doesn't have to take a lot of space to do this. Of course, when you're doing sports vision, the more space you have, the better off it is, because you're gonna be doing things like ball tosses, or we're gonna use Heco sticks, and we're gonna have them doing it with strobe. So you need a little bit of space there. So it's hard to say what a person individually needs. But you could start off, if you had a room that was, 18 by 10, that might be enough space to devote to a sports vision area in your practice.
Yep. Right. I think we had one person mention they had an unused lane. They just had a room that was sitting there and they weren't really using, and they were able to convert that to get started.
Yeah, absolutely, very reasonable to do that. You just need a little space to spread out and do some activities, and you're ready to go. And as I said, because a lot of this is portable equipment, it makes it really, really easy.
Right, and I have a picture of the Thrive up there right now, and it looks like even the front part of it almost looks like a handle, right, where it folds down and you can just take it with you.
Yeah, it actually almost looks like they reconverted the top lid of the laptop, and actually the sides fold in, and it just closes up into a nice, tidy little laptop. So it really works well as far as portability goes. So really, really, really nice. But as I said, most of these things are run off PCs or iPads today, so you can get a lot done.
Yep, and I'm pulling up the report again just because to me this was an interesting thing that it showed different cognitive areas, right, that you can push on, right? I guess there are 1, 2, 3, 4, 5 of them. When you're working with athletes, do you sort of focus on any particular one, or do you show them holistically what everything's all about, or do they, get really jazzed like, oh, my reaction time went down 100 milliseconds? How does that work?
Well, I think I like to begin out and show it to them holistically. I want them to understand what each area does. Like when we talk about executive function, I'd say that's decision making. Okay, that's how you ultimately make all those decisions. Visual spatially, that tells me a little bit of how the visual system is integrating into the cognitive system. How you're taking in visual information in a wide space. So I want them to understand those particular elements. And look, if they're sitting in the yellow zone or the red zone, obviously that's an area for improvement, and we need to work on those skills. But even if they're in the low green zone and they're an athlete, don't forget the difference between like vision therapy for a child who's having a problem, or a patient who's had a traumatic brain injury, and a person who's an athlete is the first group you're going to take someone with poor skill and make it normal. With an athlete, you're taking mostly people with normal skill and you're going to make it elite level. Okay, so a low green may not be good enough. Okay, so I'm going to try to take them to a higher green level where they score at a higher point by improving those visual skills that feed cognition.
Right.
Basically, you mentioned you've been in practice over 30 years, which means that your practice may be aging with you. Are you making any sort of plans to work with people that might have cognitive problems of the elderly? Is there any work being done there for people that are older, that are starting to lose it? Are there ways to test?
Well, certainly, yeah. I think obviously, being the fact that I see a good amount of stroke patients and because we actually even go into the hospital once a week and see patients in the hospital, and many of them end up coming to our office. And so obviously many of them have some, whether it be beside the neurologic injury, they have other health issues that they're dealing with. Okay, some may have Alzheimer's, some may have Parkinson's. Some may have, many have diabetes and hypertension and all sorts of things. And don't forget, any type of situation like any type of health issues can affect neurocognitive. The other thing, and I talked a little bit about this yesterday in my lecture on concussion, is that with concussion, with any type of neurological injury, what you get is neuroinflammation, and that creates brain fog. Okay, so when you have brain fog, you have to figure out ways to minimize that brain fog, and that brain fog is obviously going to affect cognitive function. So a person who has some of these aging type syndromes or has some health issues related to aging, they're definitely going to show up with reduced cognitive skills overall. And it's easy to demonstrate that. I mean, I've had some people that have, scored in the red area in virtually everything they've done. And certainly with therapy, we can kind of elevate those levels. So certainly in my practice, because sports vision is not the only thing we do. Obviously, we see a large amount of children who do, whether it be autism, ADHD, dyslexia, strabismus, amblyopia. We see patients who have had traumatic or acquired brain injuries that we talked about. We've had sports vision. We have myopia management. So all those types of patients that we're seeing, because it's a widespread, it gives us an opportunity to use all these tools no matter what the situation is.
Yep.
Great.
Well, great. Well, we're just about out of time, but thank you so much for this today, for stopping by, and thank you for all the lectures that you put on, and thank you for this event. I mean, it's been really, it's been much more practical than I had ever imagined it would be. So thank you for putting this all together. I think, everybody who's attended this has gotten a lot out of it.
Yeah,
well,
and one more point.
Oh, go ahead.
Charles, this is going to be on ODwire.org that has 24,000 readers, and they may have some questions. Would you be able to come back and answer them on ODwire in the event there are questions?
I'll be glad to do that. I've had a really good relationship with ODwire. I know I did a sports vision lecture for them in the past. I've done a brain injury lecture for them in the past.
Yep.
I really enjoy the whole aspect of it and just getting the word out to optometry, because believe me, there are a lot of optometrists out there who are interested in sports vision but don't know how to get started. And this is just a great opportunity for them to get the nuts and bolts of what they need to do to be able to get started in the world of sports vision.
Absolutely. Well, thank you so much for being here today.